baba utapata mwana si wako. Niliambiwa na babu yangu kweli, zuba zuba utapata mwana si wako. Nimeamini kilichosemwa na babu, nimekubali kilichosemwa na babu. Gaga na upwali wali mkavu, gaga na upwali wali mkavu. Iro moro neno kwako boche polo, aninyi sauti no duoga Nairobi. Nenya suna tindelo soda lawane, osiptende ogeroti o maber. Nyakayede tindi yudo tetete, okandara tindo payiringo maber. Lo sé, tieno lo sé na la wani, lo sé, tieno lo sé na la wani. Yakaka bondo, lo sé na la wani. Yakaringiti, lo sé na la wani. Mkamfangano, lo sé na la wani. Koyugi, lo sé na la wani. Kampondo, lo sé na la wani. Niña Karemba, lo sé na la wani. Koyugi, lo sé na la wani. Kindumbei, lo sé na la wani. Omabei, lo sé na la wani. Yakaramula, lo sé na la wani. Lo sé na la wani. Ay, ay. Lo sé na la wani. Lo sé na la wani. Lo sé na la wani. Donga tieno lo so ya. Lo sé na la wani. 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 Cheng no nega, nyawanga yangama. Atali nyawanga ya to cheng no nega. atieno gigo manitimonwa, atieno kuonde maniterowa, atieno yo. Atieno kuonde maniterowa, atieno gigo manitimonwa nyasuna Ani mama kelo to baba los baba kelo to mama loso kalando nyawanga ya loso ni mama loso kalando nyawanga ya loso ni mama loso baba kelo to mama loso baba kelo to mama loso kalando nyawanga ya loso ni mama loso.
Tazama band, asante sana. Asanteni sana Tazama band, tupate
Thank you.
National anthem.
Twaomba. Nyasaye korote ochomo kamotome otambe dhogeria kwacho. Jong'eyo nong'eyo minolondo go piny ni mama ok nyal tiyo e kaunti ma Homa Bay ka. To mana lwet mama no koro kawuono emwaneno kander ni po e konde duto ma Homa Bay County. Mana lwet mama no jaduong' emwaneno ka pige kunyo e wards. To e lwet 100 nyowaneno ka nyithindo 540 oka ochulonegi fees kochakore form 1 nyaka mbalariany. To nyowaneno kokao nyamreru adute county moketo NHIF mondo gibe ka gituo to githiedhre kaka dhano mamoko. Nyasaye gik mosetimore lwet mamani wawuoro. Igwedhe tigwedh wuono chieng' ma wuod magwanga. Kawuono ni wabiro mondo wayaw kama ibiro thiedhe nyithindi mithiedho to dok kod mago mabiro dhi e yeng'o matindo. Nyithindi duto tema no thiedhi osiptande ni moyaw manyien ni gikonyre lweti maonge machangne obedo matek. Koro kigwedhe tigwedh jotich duto, tigwedh our security team, and we pray for your blessings upon our guests for this day. My humble prayer in the name of God the Father, the Son, and the Holy Spirit. Ngato wachini amena.
Asante sana Pastor kwa maombi ya nguvu sana. Kwa gavana wetu mpendwa, naibu wa gavana, mjumbe wa Kabondo Kasipul, mgeni mheshimiwa na wageni wote waliotoka upande zote na waziri na hata madiwani. Mmealikwa kwa siku ya leo na kuchukua fursa kama hii niwakaribishe wote hapa Kabondo Kasipul. Jo Kabondo Baumor. Baumor ni gavana nika. Kimoti fuana kama. Nachukua fursa hii pia niweze kuwaita wale ambao wanataka kuburudisha gavana na wageni wake. Nitaanza na Koli Matete Band na nitakupatia tu dakika 2 kwa sababu mko wengi, kwa hivyo ukiendelea nitakukatiza kwa kutumia kipaza sauti.
Ay, nyamrerwa kwenywa budho kaka nuwa budho chaurwa kumama gisigalagala. Eni wachango mama, tonya wangaya to eni wachango mama, chango mama, tonya wangaya to eni wachango mama, egila donga weroi. Miseko timono to enwa oyuna kwangatiacha enwa chango mama nyarai ewe enwa chango mama ifo bararwa koi yatelo makare to enwa chango gila wa chango mama yadiyo to enwa chango mama ilomo na mabaya baya inyawanga tuyo tulomo na mabaya baya chango mama ateno renu chango mama ifo bararohim yatele magare to enu chango mama Professor Kolia renu chango mama ifo gwanga rohim magwanga dongawari to enu chango Magande donga weroi, magande donga weroi, tuenu wachango mama, ini yudu wachango mama. Magande donga weroi, mama nyanga, tuenu wachango mama, atini yudu wachango mama, enu wachango mama. Diladis wanga to enwacha Tasha enwacha mama tanyanga ya enwacha mama diladona weroi yatelo makare to enwacha mama ateno to enwacha mama Nyare mama, eno chango mama, eno chango mama, anayo eno chango mama. Oh, we don't play Alice mama, eno chango mama, Alice eno chango mama. Oh, we treasure when it's wrong, but tell makare eno chango mama.
Makofi kwa Koliband. Nimesema ya kwamba kama umekuja hapa kuburudisha watu, hakikisha ya kwamba umetumia dakika 2. Zaidi ya hiyo nitachukua kipaza sauti nikutoe. Tuko na Kabondo West Ward CU CHVs. Mkiitwa mnafanya haraka. Alafu watafuatwa na comedian Nyaringa. CHV. Amko tayari? Mko tayari? Haya, mimi naanza kuhesabu dakika.
CHVs kujeni haraka, kujeni hakuna time.
Hello. Kabondo Westward machiegni uru. Timuru chap. Time kethore. Wakasre uru ketsa.
Mfanye haraka. Msonge mbele huku.
Manembele ugin nyamrero wa Kabondo Westward siusa deka kumulo wa Kodhoch apa Kodhoch machiegni uru. Wangi wer matin mwaparo go mama gi gimotimo. Be ung'eyo gimotimore. Kabondo be ung'eyo gimotimore. Yawa be ung'eyo gimotimore. Yawa be ung'eyo nadiso totiyo. Yawa be ung'eyo nadiso totiyo. Yawa be ung'eyo nadiso toloso. Yawa be ung'eyo nadiso nyakano. Adiso nyakano danda. Yawa be ung'eyo yugi betiyo. Yawa be ung'eyo yugi totiyo. Yawa be ung'eyo gimotimore. Osuri. Yawa be ung'eyo nosuri totiyo.
Asanteni sana CHVs, asanteni sana.
Yawa be ung'eyo nosuri totiyo. Yawa.
Asanteni sana. Asanteni sana.
Haya, makofi kwa CHVs. Haya, asanteni sana CHV. Nachukua fursa hii niweze kuita binti comedian Nyaringa kisha binti shupavu. Mkwe tayari?
Yeah.
Comedian Nyaringa, dakika 2 tu.
Control. Yeah.
Control.
Yes. Joka Bondo untie.
Gimomo na ni dano pire ti mata nyaka an gi nyike kaka adonjo koso kadonjo. Adonjo koso kadonjo. An gi weche moko matin madwa na wach ne joka bondo nikech kang'iyo to jomo mora kabisa. Yani ka yiego kabisa okelo gima ber okelo koso okelo. Odonjo koso kadonjo. Jomriambo neno koso koneno. Aneno kanya kanyie kama na hero kabisa kichwa moja digri 3 bendo donjo ka uneno koso kuneno. Gimomora kidhi yuanito chiko matinda 14 wacho ni an gima lit ne ngimana ni ka poto jo kata biro teda jabe liena to jomodong to chamo ta ana dong kaling ti. Adwa ni goye gimoro kanyo matin mondo ganda koro gine kaka wajatimo mapiyo piyo kabisa. Nikech yieke ga gi oaka to chako lao kama chielo. Nyiego pare kama ne wae kodi wiki kwil. Mano nyiego nyaka wuotho gi wuoche ga te. Ng'ama nong'e ni nyalo biro ka onge. Ng'ama nong'e ni nyalo biro onge. Nyieka koro nyaka tem lungo ne.
Nyariga, what you gonna do, ma? What you gonna do, my baba? Hey, we have to go do my baba. You go do ma? How we do ya? What you go do ma? How we do my baba? What you go do my baba? You go do me do get kanyo. You go do my baba. We had to go do my Jaco Malaba. You go do my Jaco Malaba. Pago DJ don't go there no baba. Pago DJ don't go there no baba. Pago DJ don't go there. Hey wanga iri asunge kulu. Hey mama nya wanga ya asunge kulu ba. Hey nya wanga ya asunge tuma.
Asante sana Nyariga.
Aya. Mani kanyaka ne mia pulo nyaka wuo. Anu weng'io na sa. Mani nyeka ko sok nyeka. Nyeka nyaka wuga wuo mabera. Wuo ko sok ka wuo. Kidi Ayubu 21 matin 2 wacho ni miya uru thuolo mondo miya wuo nikech samoro nitie gima nyalo maya kwe kata nitie gima nyalo mayi kwe. Awuo koso kika wuo. Mama adwa nagoni erokamano maduong' ahinya. Sani endi andi chuo manyocha yudo nyocha miya paro mang'eny. An gi nyithindo 3, nyathi achiel sani ni e iya kan go gi dweche 4 mama. To chunya ne gore ni to koro en kanyuolo biro marach tadhi timo nang'o. To ng'ato no kuodhona ni gimoro biro kel kacha chama chalo od gari gino endo kanyuolo biro mana tiso hata nyuol gi teko Nyasaye kare koso kare. Wanyuol koso kik wanyuol. Mama an sani kora dwa kete 12 ndap. Ng'ama ok dwa to mano wachne. Erokamano ahinya. Thank you so much. Nyiego Nyasaye madgwedhi. Erokamano. Nyieka be ni kama Mama Alice Winga mano nyieka. Eneno adwa ni wang'ni kori kela wiu moro nyieka no ing'e kaka idhi tieko kode.
Asante sana Nyaringa. Makofi kwa Nyaringa. Aya, binti shupavu kabla wajafika hapa nilisema ya kwamba tuko na wageni tofauti. Tuko hapa na First Lady kutoka Bomet yuko hapa. Tuko pia na First Lady kutoka Nyamira pia yuko hapa na sisi. Kwa hivyo nachukua fursa hii nikaribishe binti shupavu na ni dakika ni 2 tu, kwa hivyo mkiitwa mnaharakisha.
Binti kujeni haraka.
Praise God. Praise God again. Mawantie mbele uni binti shupavu group. To wagone Nyasaye erokamano kuom setayawa machopo odiochieng'ni. Kuom kwasechopo kae to wang'eni Nyasaye motelonwa. Gimoro amora mwadhi timo ka waketo e lwet Nyasaye. Wagone mama erokamano kuom sekelonwa osiptal. To kod daktari magiketonwa ma biro jiwowa. Wagoni erokamano wang'eni biro medo jiwowa. Amen.
Sugar daddy. Yeah.
different wahala. Problem not the finish, oh. I just wanna party every day. I just wanna party every day. So pass me the dutchie. Pretty girl, come wine pon the cocky. 10 toes, one girl, make it touch it, touch it, touch it, touch it, touch it, touch it. Pass me the dutchie. Pretty girl, come wine pon the cocky. 10 toes, one girl, make it touch it, touch it, touch it, touch it, touch it, touch it, touch it. Shut up and bend over. Let your back do the talking over. So back up and bend over. Let your back do the talking over. Say, I want to chop my life. I want to be happy. I want to dance and party to the rhythm of my body. I just wanna party every day. I just wanna party every day. So pass me the dutchie. Pretty girl, come wine pon the cocky. 10 toes, one girl, make it touch it, touch it, touch it, touch it, touch it, touch it. Pass me the dutchie. Pretty girl, come wine pon the cocky. 10 toes, one girl, make it touch it, touch it, touch it, touch it, touch it, touch it, touch it. Puff, puff, pass. My Mary Jane. I'm high on life, wanna meditate. So allow me, make I enjoy life. Cause problem not the finish, oh. Every day different wahala. Problem not the finish, oh. Pass me the dutchie. Pretty girl, come wine pon the cocky. 10 toes, one girl, make it touch it, touch it, touch it, touch it, touch it, touch it. Pass me the dutchie. Pretty girl, come wine pon the cocky. 10 toes, one girl, make it touch it, touch it, touch it, touch it, touch it, touch it, touch it.
Shit.
All right. Yes, na nilisema from now we have devolved from Tazama Band, we are Jonam. We are called Jonam, and I am also a proud alumni of Kenyatta University when Professor Mugenda was the VC. So na nimekuja hapa, nimekuwa mwanamuziki, mtanitafutia mahali niweke certificate pale. All right. So the song we are singing is called Warrior Woman. We are in love with the way women are taking over with some good revolution. All right. I've been seeing in Africa, every woman working harder, from Morocco, Zanzibar. It's a revolution, I say I'm saying this, yet I'm a man. Would you tell me I'm a liar? I've been seeing in Africa, every woman working harder, yeah. I've been seeing in Africa, every woman working harder, from Morocco, Zanzibar. It's a revolution, I say I'm saying this, yet I'm a man. Would you tell me I'm a liar? I've been seeing in Africa, every woman working harder, yeah. Now I'm a feminist, and I like what I see in this city. Every woman working harder. I'm a feminist, and I like what I see in this city. Every woman working, warrior, 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 warrior woman, warrior, 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 you can win this war. Warrior, 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 warrior woman, warrior, 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 you can win this war. Nalogi onseko kalo atieno nene wa mi pacho nene singo ni birorito tokende timo kakani chiko atieno wacho atieno lose dalawani lose atieno lose dalawani Nyakaringiti, loseda lawani, Nyakaremba, proseda lawani, loseda lawani, loseda lawani, atieno yo loseda lawani. Yes. Mambo ya wamama wachana nayo. Uwezi elewa. Dalogi oseko kalo atieno nene wa mi bajo neni tingo ni virorito. Thank you. Hey, kendi chiko ni kani chiko. Hey. Dalogi oseko kalo. Thank you. Atieno nene wa mi pacho. Ay. Neni singo ni birorito. Ay. Tokendi timo kakani chiko. Thank you. Atieno lose dalawa. Lose, atieno lose. Arosi. Lose, atieno lose. Hey, arosi miela. Nyakaringiti. Lose dalawani. Mfangano. Lose dalawani.
Asante sana.
Thank you.
Asanteni sana. Manotumba powerful. Asanteni sana tazama band. Akautulu manyise jodalawani. Gari kacha ni tiere screening miti pogore ntie mar cancer, diabetic, pressure inyalo dhi kacha mondo ipimruok nono odiochieng' makawuono. Nachukua fursa tena kama hii niweze kujitambulisha. Mimi ni Rachel Gutu, Government Spokesperson, Homa Bay County. Nachukua hii fursa nipatie Dr. Suri aiweke kwenye kitengo kingine. Dr. Suri, karibu sana ili uweze kuendeleza ratiba. Haya, nitachukua fursa hii nimkaribishe MOH, akaribishe Dr. Suri na waendeleze kipindi.
Thank you very much, Her Excellency the Governor, our chief guest, the Professor. We love you for taking the opportunity to come here. All protocol observed. All the sub-county team kindly come in front. All the staff from Rachuonyo East, tafadhali ni kujeni mbele hapa. Her Excellency, we want to appreciate you very much for what you've done. And now we have a theater and a complete theater and maternity services. We appreciate what you've done to the sub-county and will improve the service indicators. Sub-county team, kindly hurry up. Facility staffs, kindly come. All facilities, the rural health facilities, all the rural health facility, kindly come. Yes, very much. Now, just say your name, one name, please.
Yeah, my name is Victor Ndago. I coordinate disease surveillance in the sub-county. Thank you.
Okay, my name is Yogo Duncan, Sub-County Human Resource.
Tamima Omondi, Nursing Officer in Charge. Leonard Okumu, HIV coordinator.
Wycliffe Ochieng, TB coordinator.
Lillian Tindi, Sub-County Public Health Officer.
Matias Ochieng, Sub-County Malaria Coordinator.
Abi Lobiero, I coordinate Community Health Services, Nyamrerwa.
Masingonga, Nutrition Coordinator.
George Okech, Accountant.
Cyril Akinyi, Occupational Therapist. Grace Akinyi, Nurse.
Lilian Ojijo, Deputy Nursing Officer in charge, Kabondo Sub-County Hospital.
Jacqueline Lydia Tieno, Nursing Officer.
Dominic Odhiambo, Deputy Lab in charge.
Osiemo Frederick, the Promotion Officer for the Sub-County.
Stella Chepkemoi, Maternity in charge.
Winnie Odero, Secretary.
Stephen Omondi, Amanas.
Janet Luchera, Nursing in charge, Dudu Health Center.
I'm Krista Belodero, Nursing Officer, Got Kamondi in charge.
Wanga Samson, Health Administrator, Utoro.
Edwin O'Brien, Nyandiwa Dispensary in charge.
Ochieng Patrick, Health Administrator, Rachonyo East.
Ogalo Michael, Clinician, Utoro Level 4.
Awar Irene, Laboratory Officer, Kabondo Sub-County Hospital. Thank you.
I'm Judith Rajwai, Sub-County Public Health Nurse. Thank you.
I'm Martha Otula, the Sub-County Reproductive Health Coordinator.
Thomas Onyanga Cage, Public Health Officer. Thank you.
Charles Otieno, nurse from God Kamondi Health Center.
Pauline Ombul, Nurse, Kabondo Sub-County Hospital, in charge MCH.
Lorraine Oyengo, Ringa Health Center in charge.
Okumu Lamek, Clinical Officer, Kabondo Sub-County Hospital.
Jen Onyango, Nursing Officer in charge, Arambe Health Center.
Timothy Ogutu, Chief Driver, Kabondo Sub-County Hospital.
Thank you. Mine Joyce Auma, Link Assistant, Kabondo Sub-County Hospital.
Collins Ochieng Otonda, Nursing Officer, Kokwanyo Health Center.
Dina Okeo, Nursing Officer, Atera Health Center in charge.
Robert Obunga, Atemo Health Center, Nursing in charge.
Esther Ometi, Community Health Officer, Kabondo Sub-County Hospital.
Yes, my name is Silas Mado. I'm the Sub-County MOH. Your Excellency, we are more than happy. Jodongwa maka kaka nu nyisa ne umorcha adwa ni moda watne governor wicha de kende. Achiel, the MCA my area no se support wakabisa kane watioka jibedo kanyaka utieno omiago nuero kamano at the MCA of the area. Jodongo magwen kae kanyocha wariegi ne Her Excellency the governor nyocha wecho chochni matin samoro ne wakwara wang'wa mondo wariegi makamani. Omionege wacho ni kaber makama biro to gi mor kodi kendo gi yie mano riegi ni maonge ng'ama nodhawo ka ji nodhirore adhira matin to bang'e ne waduogo wanyiero mwamadho chai. Omiyo wan wamor, an kaka the Sub-County MOH amor kendo wakwayo ni support mumiyowa jodhi wanyuolo mana ji 200. Ambe ka wiye mine obi onyuol 200. Otherwise, Her Excellency the Governor, we are very happy. The Professor, we are very happy. And now, let me take the pleasure to invite the Chief Officer, Dr. Kevin Osuri, to take it to the next level.
Thank you. Your Excellency, the Governor, the Honorable Chief Guest, Your Excellency, the Deputy Governor, all protocols observed, all dignitaries, my colleagues, and health workers. Good afternoon. Good afternoon. First, Your Excellency, before I say anything, I would want to recognize the presence of our staff, our senior staff who are here, even from the other sub-counties. I would ask them wherever they are to stand up so that you see them and just wave in the interest of time. Thank you very much. Your Excellency, I see Dr. Odundo, the one in charge of Ndewa. I see Dr. Otana, the one in charge of Rangwe. And Your Excellency, I see Dr. Ray Kajuang, who was the former MedSoup and the MOH of this facility. In fact, when this building started to be built, he was the one who was in charge here. I was just whispering to him that maybe we need him back here again. Your Excellency, the Governor, and all distinguished guests, it's important to note the significance of this exercise today. The maternity and OPD building that we are launching or commissioning today will really open up, especially surgical practice in this sub-county, and indeed in Homa Bay County. This is the newest theater that we have commissioned in Homa Bay County. It is significant since in this part of the county, we have been referring patients to Homa Bay and to Rachuonyo South. And given that now we have the capacity to do both minor and major surgeries, we will reduce significantly on those referrals and be able to save a lot of lives. Your Excellency, under your instructions, we have also posted staff here who are capable to operate this facility. We have an anesthetist, he's here with us. I think he's in the crowd here. And as well, a medical doctor will be able to operate in this facility and actually bolster also on the leadership. Nyamrerwa untie. It is also important, Your Excellency, to recognize the role played by Nyamrerwa. The Honorable Prof. Nyamrerwa in our local dialect is community health promoters. And they are really going to help us, especially with our primary health care. And I can assure you, guest of honor, they are clapping like that because we take good care of them. We pay them a stipend, and we also have managed to pay for their NHIF. In the interest of time, Your Excellency, I would want to recognize some of our partners that we have here. We have Matibabu Trust, African Cancer Foundation, Matibabu Trust. I think Dan is around. We also have African Cancer Foundation, Wairimu, she's there. We have LREB, that is the Lake Region Economic Bloc, led by Her Excellency Mrs. Emily Nyaribo, who's the chair, and Her Excellency Salin Barchok from Bomet. I hope I got that correct. Thank you so much. So, Your Excellency, I would request that as we begin, you accept on behalf of Homa Bay County a donation that has been given to us. You see, today I'm dressed in a very nice suit, and most of our healthcare staff. All these have been made possible and have been donated to us by the African Cancer Foundation and Matibabu Trust. So I would ask them to donate to you just a symbolic carton that has the scrubs and masks, a total of, they gave us a total of 1,000 pieces. Okupa meje juthuru. So, Your Excellency, you're welcome to receive this donation on behalf of Homa Bay County. So, Her Excellency, Madam Nyaribo and Barchok, you can join the governor, because you are the ones donating this to Homa Bay County. Thank you very much. Let's give them another round of applause. Asante sana. Nyamrero ubende le pubiro. Come on. Your Excellency and the honorable guest, you'll allow me now to invite Madam Leila to give her brief remarks. Madam Leila is from the Division of Nutrition in the Ministry of Health, Africa House.
Walizani wananimaliza, kumbe wananisogeza. Walizani wananimaliza, kumbe wananisogeza. Walizani.
And all other heads of departments in the Ministry of Health. I know there are several CECs represented here, and the Director of Health Services, and all Homa Bay government, county government officials, representatives from partner organizations, and Jo Homa Bay. Amoso uru duto. Mrembe uru. Mrembe kendo. Amen. So it's a pleasure to join this county government of Homa Bay during the launch of the County Nutrition Action Plan 2022-2024. Allow me to congratulate the county under the leadership of High Excellency Governor for developing this strategic document for nutrition, which is aligned to the Kenya Nutrition Action Plan. Having a costed nutrition action plan is a demonstration of the commitment of the county government in improving nutrition situation of its population and addressing the persistent malnutrition in the county. I wish to commend the county for employing significant number of nutritionists since devolution. And one thing I need to say about nutrition, or lishe bora, that it is essential for health, well-being, and quality of life of the population, including human capital and economic development of a nation. When the people of Homa Bay are well-nourished and are healthy, they become productive and have potential to break the cycles of poverty. I'm very much aware there is a cycle of poverty in Homa Bay and also a cycle of teenage pregnancies, which can be broken when we invest in the right places. According to Ban Ki-moon, the 8th Secretary General of the UN, the United Nations, nutrition is both a maker and a marker of development. If really you're interested in the development of Homa Bay County, nutrition is the maker and the marker of development for the county. What I mean by this is improved nutrition is the platform for progress in health, in education, in employment, in empowerment of women, and reduction of poverty. Yet Kenya, malnutrition is the leading cause of morbidity and mortality. Magonjwa na vifo vya watoto chini ya miaka 5 ni kwa sababu ya kutokuwa na lishe bora. Kwa hivyo, if we get it right, what the message is, if we get it right as Governor Gladys, if you just put the right investment in nutrition, you might actually just resolve all your health issues within a very short period of time. And the ask is very, very simple. And that's why we have developed with the County Nutrition Action Plan, so that when you develop in the nutrition, a child, right now in Kenya, when a child is born today, they only achieve 55% of their full potential. We are competing with countries where the children will achieve 90% of their full potential. The investment areas is social, health, and education. And in the health segment, nutrition is a pivotal area of investment. In nutrition, we say we are not begging for you to invest in nutrition. We are actually saying nutrition is an investment. It's a smart investment. If you put 100 shillings, Kenya should put 2,200 Kenya shillings in return. That is the return on investment for nutrition. That is the potential in terms of the economy of a country or a county. And what we are asking is the scaling up of 11 interventions that are very critical for nutrition. They are called nutrition-specific interventions that actually are very easy. Promotion of breastfeeding, promotion of complementary feeding, vitamin A supplementation. So these are some of the things that we, if you, together with us, we work collaboratively with the partners who are here, we are able to reverse the generational issues that have faced Homa Bay over a long period of time. So my kind request, even as we launch this strategic document to Governor Gladys and the entire support team that she has, is that we hope that you're going to allocate resources for this document collaboratively with your partners. I know there are several, I'm aware several partners are going to commit to the document. And also promote prevention and promotive services. It is expensive to treat. For example, a child who is moderately malnourished, you need around 8,000 shillings. When they are admitted in hospital, you need around 25,000 shillings to treat them for acute malnutrition. I'm sure you have seen some of the commodities that we use. So if you invest in preventive promotive services, then you are able to reverse these expenses to nutrition. The last request is, currently we still have children who are malnourished, they need treatment. We also have the human resource component. Yes, I know we have Nyamrerwa, who are actually the interaction between the households and healthcare, but we also have this heavy component of nutrition service delivery at facility level. So we are also hoping you're going to employ more nutritionists, and they are going to be able to, and also nutrition-sensitive cadres like nurses, who are going to support in the ensuring the health of the Homa Bay people is improved. So thank you very much for allowing me to attend this auspicious occasion to launch the Nutrition Action Plan, and to thank you again for allowing this document to be launched today. Thank you very much.
Thank you so much, Leila. Can we clap for her again? Your Excellency, the Governor, we also have with us the sub-county admin here, the various ward admins, the chief and assistant chief, a number of them. In the interest of time, you may not speak, but we recognize your presence. The DCC and Karibu Sana, and the entire provincial administration, we recognize your presence. Your Excellency, the Governor, the top health team is also here. That is the CHMT, the County Health Management Team. Could you please just stand up and wave, led by Director Dr. Ukomo. Thank you so much, CHMT. I am rightly guided that the DCC, please karibu and speak on behalf of the provincial administration. I'm told naweza shikwa nisipo sema DC aongee. ACC, DCC, inanichanganyisha kidogo.
Kabondo, wamosre urane kama. Wamosre urane matek matin.
All protocol observed. Her Excellency, the Governor, the Deputy Governor, our Chief Guest, our CCC, and all protocol observed. Let me take this particular time to invite you again to Kabondo. You've done a lot to us. Just 3 weeks ago, we were opening a maternity ward at Ringa, and this time we are also doing this. So, Jo Kabondo, Bumor, Adier, Eruru Kamano. Because of interest of time, allow me to invite the DCC team, the security team, so that they can come and just wave because of time. Kujeni.
Excellency, the Governor, Homa Bay County, Gladys Wanga, the Deputy Governor, all protocols observed. Wananchi watukufu wa mjabo. Kwa majina naitwa James Maina Aram. I'm the DO1 Rachuonyo East. And on behalf of the DCC, Rachuonyo East Sub-County, I take this opportunity to welcome the Governor and her team. Karibu, Governor.
Her Excellency the Governor, the Chief Guest, the Deputy Governor, the area MP, and all protocols observed. My name is Joseph Maswi. I'm the OCS Otoro Police Station, and on behalf of the Sub-County Police Commander, nasema karibu sana. Na security, hata kama nimeambiwa ni wave, nitaongea kitu moja tu, kwamba security starts with you. Na ile kitu tunataka tushirikiane sisi sote kama watu wa Kabondo tuweze kuimarisha mambo na security. Ile kitu ya maana ni kushare information. We share information, tusaidiane ndio tuweze kupambana na hali vile iko. Otherwise leo sio siku yetu. Governor siku ingine pia upange siku ya security ndio tuweze kuongea mambo mengi kuhusu security. Thank you very much.
Asanteni sana. Our governor, all our admins, our apologies. They are attending a meeting in Homa Bay. Speaking is Daniel Simba, the sub-county administrator. Asanteni sana.
Thank you, Mr. Daniel. Can we clap for them? Asante sana, Your Excellency. Now it's my singular honor to invite Mheshimiwa Nyakomita, the MCA of the area. Karibu sana, Mheshimiwa.
To Her Excellency the Governor, the President of Homa Bay County, the endless potential, Geno Majo Homa Bay, Erejok Makonya Rwako Governor Kawuono. Uneno ka Mama Okelo, for the first time waneno Prof from KU University. Prof, feel welcome. You are in Kabondo Westward, you are in Kabondo constituency and in Homa Bay County. We welcome you. Wangi Deputy Governor. We have Deputy Governor Wonochieng Tiacha is also present. We welcome you, Deputy Governor. We also have in Kabondo Kasipul, well known as Kichwa Moja Degree Tatu. Hey, Wangi Mujumbe Marwaka Mama, also feel welcome. Her Excellency, I borrow from what you said from the wise men sometimes back, that a person with a good character will always give a promise. And you gave us a promise that we are seeing being actualized today. We are very proud of you, Her Excellency. This is the moment we have been waiting for all this long. Today we are able to see what we call the light at the end of the tunnel. We are very, very much proud of you, Mama. With your permission, just allow me to introduce two people. First, Jowa Majo Party. Dogwan gi Jowa Majo Party maro ODM kai. ODM untie. Ereja koma kwanya just a word. Very fast.
Thank you very much, Bwana MCA of the area. Aneno ka Governor Nyero mos ge Kichwa Moja Degree Tatu. Wago erokamano ahinya jo party manika. Waduoko erokamano ahinya ne gima timore Kabondo Kasipul. Dongu yie go jothurwa. Dongu yie no ta ometimore. One kaka jo party achiel wawacho ni wakaribisha Her Excellency Mheshimiwa Gladys Nyasuna Wanga e Kabondo Kasipul, kendo wamor kode ka gin gi Wonochieng to gi Kichwa Moja Degree Tatu Kata aneno ministers machiek mano yiero. Kendo wamor kodgi kanya wabiro ng'iyo tich ka to wayudo Dennis Onyango kane ka saa yote. Waduoko erokamano. Jo party mantie te chunga mondo fua nikech time. Anena Amina kanyo, women leader marwa, aneno coordinator, eto nyako fua matin. Coordinator B mondo fua, please. Aneno secretary Dr. Okongo, secretary ma West, Mr. Dao, wat matin usipa.
Your Excellency, our Governor, Jalupini, wageni ambao umealika kutoka nje, kwanza kwa niaba ya chama ambaye ni chama ya kimataifa hapa Kenya na Homa Bay branch or county coordinating committee, we are happy as a party who sponsored you to become a governor, that you are performing extremely well. Thank you.
Thank you. Erokamana ahinya, one party wa ung'eyo ni en Raila Amolo Odinga. Mane party wa? Mane ODM? Kendo ng'ama ok oluwo Raila Amolo Odinga, wanego rego. Raila Amolo Odinga waluwo gimoro amora ma owacho wabiro timo. Kendo warito ng'anyo mare. Warito ng'anyo nikech gik matek Kenya ka. Donge? Erokamano.
Ma'am, again, if you allow me in just 1 minute, we have one of the stakeholders. We are in Kodoch location, and we have with us here one of the stakeholders. He's been the board chair of the facility before. Just to present a small memorandum, with your permission, please.
Irokamano bwana MCA ne ebo governor Orachwenyo nini Homa Bay County. Our deputy bwana Joseph Oyugi Magwanga, our able MP Madam Obara, welo madongo gi matindo mantiere gi community ya mosuno kwe uru. Amor madam ka lek mane wachako kan jakom board mar osiptandni ka watiyo gi Dr. Ray Kajwang ochopo kare. Kendo wago erokamano ne your able government mokonyowa fulfill our dream. No chakore madam manogi kama okelnwa nyaka picha marot moserumo. To wan kaka jo sub county ne waonge nyalo to ne walema to Nyasaye gigolowa e lwedo magalagalani. To wayie ni Nyasaye ogolowa kendo kori biro ma odni orumo ma kendo kori timenade iyawe. Wago ni erokamano. Madam, mondo odni obi obed ot kata mondo obi oti maber. The community ne kwayo ni mondo ifurnish with equipment kaito ichaki able human capital manyalo biro tiyo gi machines mibiro kel ka. Nikech ne realize kata ne waneno gima nomiyo wachako ka ni Rachuonyo East Sub County was the only sub county mane gi theater. Madam kikelo theater Kabondo Gideka Sipol Kabondo Kasipol constituency, we are happy for that. Koro miyo wakwani kaber mondo odni obio fulfill its mandate. Kelnwa machines moromo kaitimiwa manpower maber mabiro tiyo gi machines go mondo jo community oyud konyruok ka ok wabedo gi chandruok. Mane ka odni biro bedo gi meaning. Ariyo, awakwayo ni mondo odni obed complete. In future, you are able government omiwa mog ka for any eventuality koro kwaring wadhi kumachielo. Maradek, awakwayo ni kaber mondo mi wabed gi sustainability of gik mabiro timore ka. Madam, in future mwang'e ni biro timo kapod intie tichaknwa gima waluongo ni KMTC e facility ni mondo nyithindwa tiegre wayud manpower ma enough. Mogik madam, awakwayo ni nyaka ne wachak
Keystone mag facilities jogo dwaro kony kaka sami dwaro ambulance. Koro ka inyalo medo no ambulance moro achiel to gi gari moro achiel manyalo konyo mondo ambulance go kik bed overworked. That will be very grateful. Ka ok kamano ta wan gi memorandum moro ma wadwa wami piny mos. To koro ang idhi through ting'iyo ni to jo Rachuonyo sub county Rachuonyo sub county nigi dwaro mage.
No, it's okay. Lastly, if you allow me, High Excellency, let me introduce or maybe bring forth my colleagues from County Assembly. I can see Joan from Kojuach, Alice from Kabondo East. I can see nominated Becky. Please, if you can come, just self-introduction, kindly, very fast because of time. Because of time, please, just your word, area you represent. Yes.
Thank you, Honorable Member. My name is Honorable Yvonne Becky. I just want to say a word. Thank you, Her Excellency. And wagoero kamano, being I was born and raised in Kabondo Kasipul, ang'eyo ngima ma jowa osebedo e yor thieth. And ma en wach mokwongo, mane the governor nochiko ni kodonjo to nyaka otim. I'm very grateful so much nikech umiyo jowa koro realize ber mar joma miyo bedo e kom. Nikech kata mjumbe wa, you are seeing the things which are taking place in Kabondo Kasipul. Wagoero kamano ahinya ne jowa. Ang'eni the next time again we are going to be here and kwa yao kendo company machielo mar rabuon e pinywa ka mondo jowa winj maber. Erokamano.
To Her Excellency the Governor and the Deputy, our able MP, our CCMs and all protocol observed, good afternoon. First and foremost, I will take this opportunity to welcome Prof. Madam Prof. Most welcome in Kabondo Kasipul. Akao thuolo makende mar gone mama erokamano maduong' ahinya, Her Excellency the Governor and the Deputy, kech tich maber magitiyo wang' achiel. Magi gik mane wagomba. Ramula obwogo ji mang'eny, adier koso miriambo. Rabula within 2 weeks, Ramula o change kendo lokore gimachielo. An kawuono kadonje i osiptal ka ayudo ka nyaka machines nitie mar operations, nitie nyathi ma kibuoga ma ok obiro e wang' sa, to nitie machine mikete nyathi nyaka rom. Ber koso ok ber? Kane wago campaign, ji ne wacho ni mama ok nyal tiyo. Ne wan gi tich matek ka gi kacha, to Nyasaye ma jang'wono ni notimo ono moneno mama malo nyaka kanye. Kuonde ma mine otele, lokruok liche sawa. Dong mana adier? Omiya kwayo ujo dalawa ni wang'ni watiuru matek kaka mama tiyo matek, wan be wan MCS, watiyo gi governor hand in hand. Kendo ang'eyo ni gik mang'eny biro, pige ikunyo, yore iloso, osiptende thietho, gik moko te biro. Mine wagoluru kede badwa, osiptal kawuono ni ka, chuoyo ube ikre uru. Hallelujah!
To Her Excellency the Governor, Deputy Governor, our MP, CCMs, all protocol observed. Inilunga ni Mheshimiwa Joan Ogada, MCM Kojuach. Jodala wafwana urukamani, Bwana Yesu asifiwe. Hallelujah. Jodala wa yeuru monda gone Her Excellency erokamano. Ka Her Excellency no biro ka, Her Excellency chalo mzungu. No wacho ni bang' dwe achiel, Ramuli gero kendo theater iyao. Oyao koso ok oyao? We achaka gone ne Raila Amolo Odinga erokamano wuon devolution. Dok Raila Amolo Odinga, magi koro gin mana fruits mag revolution. Ivo Baranika wa MP, fruit mar devolution. Her Excellency Gladys Wanga, devolution. Oyugi Magwanga, devolution. Joan Ogada, devolution. Gimora Mora, devolution. Ber kosok ber. Machielo. E chokruogni. Ivo Baranika, our MP, Governor Nika, one by one kaka MCA. Ere mama mapeka. Ki pek to biwa mi pesa clinic. Ere mama mapeka. Ere. Hello? Ere mama. Oh, makende. Mawaeo. Goluru kede badu mondo utimru nade. Unyuol Gladys Wanga ka. Unyuol Ivo Bara. Unyuol Joan Ogada. One ka. Hey. Mama inendo. Give hero. Ere. Magi wadwa wo pesa clinic dua. Hey. Hello? Mato wuondo wa mana magi. Mana ng'wen gi kende. Ang'o mawacho? Pesa clinic to wadwa chiwo ka kata na joya chiwo. Wawacho ni ya. Wa mama. Kik wageruru building ni. To kik ubi unyuol ka. Nyaku unyuol ka. Eka tijni dhi nenore ni tich motiyore maber. Kabondo kasipul, ji onyuol. Chuo bendo timre nade. Odhi e tich mondo mine wa onyuol. Machielo katieko. Mondo wachiw pesa clinic ka. Hello? Agone mama erokamano. Nyocha ne jothieth dhi on strike. Seche duto te. Mama otieko strike osoko tieko. Otieko kosoko tieko. Nyamrerwa untie. Nyamrerwa hai. Mama ngeni nyamrerwa ntie kosonge. Mama ngeni nyamrerwa ni gene chaef kosonge onge. Nyamrerwa ber kosok ber. Gima ngeny go Nyasaye oritu e nying Ruoth Yesu. Koro magi biuru.
Aya. Joan. Aya. How am I in 1 minute? Aya kuyie natadwa matieko. Gima Joan gi Alice owacho no. Akwayo ni if they can walk the talk. If Joan and Alice can walk the talk, then Nyakomita will be ready anytime. So that we say what we mean. Ano maduong' ahinya ne wasiris ma wan godo. Imiyo wa jotelo maber kabisa. Adwa confirm ni wan watiyo gi ministers ma wan go gi kochako gi wasiri mar water. Kado onge to pi man wasaywago chade pok wayudo. Interest mare ma in go miyo sani wan gi pi. An gi wasiri mochung' ne weche mek education kae. Agone erokamano nikech giketo program maber. Nyithindwa nyicho dhi school. For the first time waneno ka in each ward in Homa Bay County nyicho chiwo bursary. Lastly wan gi waluoro kendo wageno. Dionge kanyo knowledge in you. God bless you. Lastly, wan gi wuoyi mwaluongo ni Owadgo Chieng' Jagita. Mwaluongo ni Doki Dalaka. Wuod lo. Mama wuoyi ni yudo wuod tich adier. Obiro kago kinyi sa 12, owuok kata sa 4 otieno. Wasiri Danish, God bless you for that effort. Momiyo koro wa deliver this child. Ago erokamano maduong' ahinya. Ne welo te all the visitors feel welcome. In the Bible, kisomo mumati wacho ni dala wuora ne nitie udi mang'eny. Mano be kaka Kabondo Westward. So we have a space for all of us. if you are not in hurry to leave, Prof, you can. We have our able MP, we have the governor. Please stay with us for probably another 1 or 2 days so that we learn more from you. If not, God bless all of you.
Wapamne uru mheshimiwa. Daher mar lando nu kendo paro nu ni wan gi pim madhi nyime ka. E tent muneno e toke kacha ka wapimo blood pressure. Blood pressure gi dholuo en blood pressure. Koro dhi adhi akacha mondo idhi mondo pim blood pressure. Wapimo nyaka bende sukari, random blood sugar. Bende ka wanyalo pimo kacha wang'eyo ka in gi tuo mar diabetes koso. Ka ineno kilayo ahinya pi mang'eny kati chiemo kabisa to kibed machwe. Dhi adhi akacha mondo pim sukari. Watimo nyaka bende pim mar kansa. Kansa mar mine, mfuko mar nyuol. Wapimo kacha bende kansa. Gigi te gin free. Onge pesa michulo, kupame gir free. Dongwero ma free. Nitie ma free. Watimo nyaka immunization. Immunization en chanjo mar nyithindo. Bende itimo kacha. COVID vaccination. Corona, mung'eyo. Bende wakelo nu vaccine ka e. Sani machiegni ka chal ni diket kata lockdown manu parocha. Okubi wuotho kionge chanjo mar corona. Koro dhi adhi akacha wakele for free. Ae gima duong' itimo blood donation. Remo igolo ka. Inyalo jaka check rembi ka rembi ber koso rembi rach mondo wabed gi remo e hospital kae. Koro mago services mwachiwo ka e. As I finish, Your Excellency, adwa paro ne ji duto temo bet ka e. Hello? Wawinjore. Your Excellency, ei Kabondo East mangima. There's no single hospital with a doctor except this one. Angeni alal nuwe English mateno wa wach gidoluo. In the entire Kabondo East, onge kama daktari nitie mopogre managi kae kende. Daktari mosomo lony. E public facilities mawan go e Homa Bay County kuendege mawane gi jolony mwanyalo ng'eyo ni ng'ani nosomo kanye to en gi qualification machal nade. And we encourage our people to visit public facilities. Wakwayo ni mondo visit public hospital. Kikidhi kadongo kacha tineno ng'at moro mogero gimoro to ketidhi tiparo ni mane hospital kaminyalo thiedhie. This is the right place to be treated, where we can guarantee your safety and we can guarantee the services that we give you. Please visit public hospitals. And Your Excellency, Nyamrerwa are really helping us on education of the public. Puonj ma Nyamrerwa mi ni dhi hospital no, gino kikilingo tinyalo biro hospital kai tinyalo thiedhi. This is a public hospital, it is affordable, and please let us visit our public health facilities. Bine mobiro nyuol kai, mobiro chung kai kai te, ute unyuol ka. Katamadhi mako ichkini goru uchagi. So that let us utilize our public health facilities. Finally, Your Excellency, as I sit down, I want to thank our healthcare workers for the energy and the effort that they put to serve the public. It is no mean task, working day and night, from Nyamrerwa to the highest consultants. These guys do an amazing job, and we really celebrate the work that you do. Your Excellency, it is now my singular honor and duty to welcome Mheshimiwa Roselyn Omolo, the CCM for Health, to give her remarks and carry on with the program. Karibu Waziri.
Your Excellency, the Governor, our guest of honor for the day, Professor Olive Mugenda, His Excellency, the Deputy Governor, the area MP, of mine, I'm not saying we are old, Dr. Mheshimiwa Eve Obara, the County First Lady for Nyamira County, Her Excellency Emily Nyaribo, and Her Excellency Salin Barchok, all the way from Bomet. Who is also the chair of the Scaling Up Nutrition Network, Martha Nyagaya, my colleague CECs. Your Excellency, I want to start by introducing my colleagues who are here. But as I introduce them, I want to single out and thank my co-CEC. I call him my co-CEC because whenever I'm not there, he's the one who stands in for me. Waziri Danish has been saying. Thank you very much, Jakomala. I want to call them so that they come in front and introduce themselves and say a word.
Your Excellency and all the distinguished guests, ladies and gentlemen, my name is Dr. Joash Alo, CEC member for Water, Irrigation, Sanitation, Energy, Forestry, Environment and Climate Change, and I wish to welcome you. Thank you.
Your Excellency and all our guests that have visited us, I'm Martin Opere, the CCM in charge of education, human capital development, and vocational training. Asanteni sana.
Your Excellency, the chief guest, all protocol observed. My name is Frederick Orego. I am the county attorney, and we are happy to be here this afternoon.
To our chief guests, Professor Mugenda, our Governor, Her Excellency Gladys Wanga, the area Deputy Governor, Oyugi Magwanga, our area MP, Ivo Bara, all the distinguished guests, ladies and gentlemen, good morning. Oh, good afternoon. Your Excellency, I want to take this opportunity to sincerely thank you for considering Kabondo Kasipul for this magnificent facility. Thank you so much. You gave me a job to be the minister in charge of public works. I wake up here, I sleep here every day to make this happen, Your Excellency. This is in line with your commitment to the people of Homa Bay. You told us, Your Excellency, that we spend only 2 days in the office and 3 days in the field. And we're actually doing that. In fact, for me, I think I'm doing 4 days in the field, 1 day in the office. Thank you so much, Your Excellency. Your Excellency, Kabondo Kasipul has really benefited from your leadership. Apart from this facility, Your Excellency, I'm proud to tell the people who are here, including our guests, that you are not only doing hospitals. We have roads in Kabondo Kasipul. Your Excellency, within the short period that you have been in the office, we have a road network of about 60 kilometers that have been done, with a total budget of almost 80 million. You threw a bear kosok bear. Kokamano acquire mona bed pin. To you threw a dongumor gi governor. Umor gi limbe bar governor ka. Governor. Thank you so much. Thank you so much, Your Excellency.
Thank you, Your Excellency, Chief Guest. Allow me now to invite our county first ladies who have come to support us. These two first ladies are from the Lake Region Economic Bloc, and I will call Her Excellency Salin Barchok to say a few words before I invite the chair of the LREB County First Spouses to make her remarks. Karibu.
Okay, thank you. Your Excellency, Governor Gladys Wanga, the Deputy Governor, and all protocols observed. Hamjamboni. Hamchambo. Chamge. Very good. Sijui hiyo ingine, yeah. So, first I want to take this opportunity to congratulate our Governor Gladys Wanga for the great work she has done. Na kwa Bible tunasema a woman was created to be the helper. But because, and we normally say also, mwanamke akiwa nyuma ya mwanaume, huyo mwanaume akifaulu, tunasema ni mama ambaye alikuwa nyuma yake. Na je, sasa kwa sababu mama ako mbele, si atafanya miujiza na mambo makuu? Na kwa Biblia tena, Biblia inasema chochote kile mwanamke alipanga, hakuna hata moja ile ilianguka. In the Bible kuna wamama kama walipanga mabaya na walifaulu, na kuna wamama tena wasuri kwa Biblia kama kina Esther na Debora, na walipanga masuri na wakafaulu. Mama, mimi najua nawapangia masuri, na kama kaunti ya Homa Bay mutafaulu. Kile tunawaomba kama wasasi ambao ni tuchunge watoto, wasichana kwa wafulana. Wasichana wetu shida ni mingi ambao wanapitia, lakini tunawaomba kama wasasi tuwe karibu na watoto wetu, tuwafunze njia mzuri, wakuwe na tabia mzuri, ndio waendelee na maisha yao vizuri, masomo yao, waende mpaka kiwango ambacho tunataka. Otherwise, Your Excellency, tumekuja kukushika mkono kutoka Lake Region, na tumefurahi kwa sababu tumeona mazuri na tunakupongeza. Asante sana. Naitwa Selina Barchok kutoka Bomet.
Thank you very much. Thank you very much. Dakugone wendo hero kamano. Sigalagala mar mama mo amana Bomet. Jotent ni unulenga inya uonge pi. Dakane lwetu. Thank you. Thank you very much, Your Excellency. I now want to call upon the County First Lady for Nyamira, who is also the chair of the County First Spouses Association for the Lake Region. Karibu.
The Governor, Honorable Gladys Wanga, Professor Mgenda, a seasoned educator, Honorable Eva. I know you're called Eve, but I call you Eva. My neighbor, the Deputy Governor, and all the people of Homa Bay. Habari zenu? Homa Bay Koro? Muko salama? Nimeleta salamu kutoka Nyamira na salamu kutoka Lake Region yote, wamewasalimia leo. Na tumekuja kwa hii hafla kwa sababu tunaona mambo mazuri yanatendeka Homa Bay. Lakini haswa tumekuja kuzingatia ile kuangaliliwa wa cervical cancer. Leo nimeona madaktari wengi wamevaa vazi mpya. Na ninataka niwasihi madaktari wale mmevaa ama wale wauguzi, unapovaa hilo vazi umepewa na matibabu, kila wakati uliza mwanamke aliye mbele yako, umeangaliliwa kama cervical cancer iko ama uko sawa. Ni kwa sababu gani tunazingatia hiyo? Tumeambiwa ya kwamba cervical cancer ikipatikana mapema inatibiwa na unakuwa sawa kabisa. Na leo hapa nimeona tuna hospitali mpya, nimetembea pale ndani nikaona kuna malaboratory. Ukiingia pale mama, utaangaliliwa na utasaidiwa pale pale mezani na utaenda nyumbani ukiwa sawa. Na Ukipatikana hauko sawa, basi daktari atakuelekeza mahali utakapoenda kupata dawa. Lakini cha muhimu ni kujilinda na kujiangalia wewe mwenyewe. Na niulize hapa kwa hii umati, wazee mlioko hapa ndani, muko na wamama? Mulizaliwa na wanawake? Hao wamama ni mama zenu? Na muko na wake? Na ni wake wenu? Na mumezaa wasichana, si ndio? Nawe pia mahali ulipo, uliza mwanamke aliye mbele yako, mama, umeangaliliwa cervical cancer? Bibi yangu, ulienda hospitali ukaangaliliwa? Ili kufika 2030 hii region yote tuwe tumemaliza janga la cervical cancer. Maana tumeambiwa katika hii region, hiyo ndio kansa kuu yenye inatuua sisi wa mama, na ni ugonjwa ile iko pole. Unakuja kujua wakiliwa mapema, wataikuta mapema na watakusaidia. Ndio sababu tunasema mapema ndio best. Wote tuseme mapema ndio best. Haya, wale CHVs kila mahali mnaenda nanyi, ambia kina mama mapema ndio best, angaliliwa cervical cancer. Na tukitoka pale, wacha tena tuendelee tuseme wasichana wetu walio 10 to 14 years wapatie idhini ili waweze kupewa ile chanjo ya HPV. Wakipewa itawazuia wakiwa wakubwa ama wakija kupata mume wasipate ile virusi ya cervical cancer. Kwa hivyo ni muhimu sana wale watoto wetu wote wanaoenda shuleni wapate hiyo chanjo. Na tunajua ya kwamba cervical cancer ikichukuliwa na kama mmekutana ama mume, kutoka kwa mume kwenda kwa mke. Mume haukui na cervical cancer lakini unapeleka. Kwa hivyo kila mtu anywe katika chungu chake. Waume mko hapa, mnanisikia? Kama hamwezi kunywa kutoka chungu chenu, basi jikinge. Tumia kinga ili muweze kuzuia kupeleka hiyo ugonjwa kutoka mahali moja kwenda kwingine, ili mkaweze kutetea watoto mabibi zenu na wale wasichana mnaokuwa na uhusiana nayo. Na siwezi toka hapa bila kusema ya kwamba Homa Bay ndio county moja iliyo na teenage pregnancies zenye ziko juu zaidi katika Lake Region. Homa Bay, Siaya, Lake Region yote. Kwanza wacha niwaambie ukweli, kwa hii country mahali mimba ya watoto iko sana ni Lake Region. Yaani hatutaki wasichana wasome. Mimi nikiangalia hapa mbele, mimi naona wasomi. Naona profesa pale ni mama. Naona governor wenu hapa ni mama. Naona MP wenu hapa ako na degree 3. Si babake alikubali akaenda shule? Waume hapa mbona muachi watoto wadogo waende shule? Nataka kuwahimiza hivi. Ukiona mtoto mdogo, songa mbali na yeye. Ongelesha mke, sio mtoto. Tumekubaliana? Msipofanya hivyo, niliona juzi koti imekuja ya SGBV kule Siaya. Hiyo koti pia itakuja hapa. Hiyo inamaanisha kwamba wazee wengi mtafungwa jela. Kwa hivyo tafadhali tuanze mapema kusonga nyuma na watoto, tuache wale watoto wetu wasichana waweze kuenda shule, wasome na wakuje kuwa gavana kama gavana wenu hapa Gladys Wanga, ama waje kuwa profesa hata. Na watoto mlioko hapa ama wazazi wa watoto mlioko hapa, nataka niwahimize ya kwamba nyinyi ni watoto. Na mtu zingatia education yenu, mfanye bidii, kesho na kesho kutwa nanyi mtakuja kuweza kujisaidia. Hiyo ndio ujumbe tulio nayo kama wake wa magavana wote kutoka region ya Lake Region, ili nasi tuendelee kama zile counties zingine. Nikimalizia, nataka kumshukuru sana Governor Gladys Wanga kwa kunipa nafasi ya kuja hapa kutembea Homa Bay. County yangu ni hapa tu across. Mimi ni neiba yenu, tunaununua vitu pamoja na tuendelee kusaidiana. Asante sana.
Thank you very much. Your Excellency, I'd like to recognize the presence of our County Assembly Speaker, Honorable Gaya, and I just want to ask him to come and give a few remarks, even though he has just arrived.
Thank you. Your Excellency, the Governor of this great county, Governor Gladys Atieno Nyasuna Wanga, Your Excellency, the Deputy Governor, Joe Yugi Magwanga, the Member of Parliament for the area, Dr. Eve Obara, all dignitaries, the CECs, my members of the County Assembly, wananchi watukufu wa mjambo. Joka Bondo untie. Abiro modeko kabiwacho mang'eny, but I want to assure you that the county is in the right direction. It is being steered very well by the governor and our deputy, and Homa Bay is in the right hands. That's what I want to say because I've come late. I don't want to say much. Thank you.
Thank you very much, Mr. Speaker. Your Excellency, as I finish, I want to thank you. You called me on a Saturday evening, I think at 8 p.m. in the night, over Easter, and asked me to be here the following morning. And we met, and then you just gave me one instruction. You said, before the end of this financial year, we must finish this maternity, this building, and open it. I want to thank you for showing us good leadership, by showing us that whatever you put your mind to do it, it is done. When I went back, we sat with my team, Dr. Suri and Dr. Komo, and for a few minutes we got worried. But I want to thank you for your support, that every request that we made was approved in good time. I also want to thank you for the leadership that you've given us, and just inform the public that in Homa Bay County we deliver as one. So when we came here, there was no water, as the Honorable Member of the County Assembly of the area had said. And very quickly, the Department of Water did what needed to be done. I want to thank the contractors who have made this possible. We could have been here, all of us supervising, but if they were moving, it would not have been done. I want to thank the main contractor for the building, the landscaping contractor, and the people who brought, the suppliers of the medical equipment, for working beyond time and going over and above to deliver. As I finish, Your Excellency, I want to invite Martha Nyagaya, who is the chair of Sun Network and the CSA, to come and make her remarks for the day. She's smiling like she does not want to give remarks, but you have to talk.
Thank you, Waziri. I'm also Uduso Niokwe. Your Excellency, the Governor for Homa Bay County, Governor Gladys Wanga. Can I remove it? The Deputy Governor, Magwanga, the Speaker, Gaya, the First Ladies from Bomet and Nyamira, my former VC, and she was also my supervisor for my dissertation, Professor Olive Mugenda, as well as all county officials and officials from the national government, distinguished guests, ladies and gentlemen, good afternoon. I'm told that we no longer say ladies and gentlemen, we only say distinguished guests because some people do not know whether they are ladies or men anymore. I hope we don't have such people in this county. Now, it's a very good honor for me maybe I should start by introducing myself. My name is Martha Nyagaya, and I'm just from the neighboring county. I'm the country director for Nutrition International, which is a program for the Global Affairs Canada, and I'm also the chair of the Civil Society Alliance, which has about 400 NGOs working in the areas of health, food security, and nutrition, and I sit in Nairobi. It's an honor for me and for the Civil Society Alliance to support and participate in this event today. Not just because we have money to do this, but because I come from the Lake region, Anyaja Luo, and every time we talk about health and nutrition matters, it's very embarrassing for us. We are Kuotnikech, we are leading in all the bad indicators. And as the First Lady for Nyamira has said, as we speak now, Homa Bay County, HIV prevalence, we are top 4. Teenage pregnancies has moved from 13% to over 20%. Malnutrition, health indicators, maternal and newborn health deaths, we are above the national average. And it's embarrassing for me because every time we have national dialogue, we do not bring our programs to these counties because of poor governance. And let's not be afraid of saying it. I am very proud of Governor Gladys Wanga because she has sought us out through her advisors, and through the dialogue that we have had for the past couple of months, we are launching the Homa Bay County Nutrition Action Plan. Now, this action plan is not just another policy document that we will put on the shelves. Before we started negotiations with the governor's office, with the advisors at the governor's office, we agreed that we are not going to do another policy document that will sit on the shelves and gather dust. We have discussed with the county government. We have a matched funding arrangement with 21 counties in this country, and none of the counties in this region are part of that matched funding arrangement. And so for the first time, we have done a capacity assessment in Homa Bay County, which has passed the threshold, and we have committed 90 million for the support of this county nutrition plan. Your Excellency, in line with your manifesto, the CSN Network and the Global Affairs Canada approach to nutrition, to health, and in line with your manifesto, we will prioritize women, children, and adolescent girls. Governor has said one of the things that touch me most is the fact that we have all teenage pregnant the children who are dying as mothers. 4 months ago, we had a conversation with the governor in Nairobi. Youngest grandmother coming from Homa Bay County, a 27-year-old girl. And so, Jothurwa, wawachura dir. Duto ka statistics mek gik marichote athurwaka. During the COVID-19 pandemic, just that 10 months when our children pregnant girls between 11 and 16 years old. It's a shame on us. And we would like to work together in this program to address not just maternal and child deaths, but also address the issues that are affecting adolescent girls. This is a county where we have powerful women. We have Dr. Ivo Barra here. We have the governor. We have a number of women who have reached their full potential because they were not pregnant at the wrong age. I saw the girls who are dancing bend over here, and I felt a bit embarrassed because I don't know how far we go bending over. And I would like to make this a comprehensive program to an extent that it is not only having maternity care for pregnant, ensuring that our MNCH services have special catering for young girls who are pregnant because they are not yet women. But besides that, we need to prevent teenage pregnancies. And find out who is making 11 to 16-year-old girls pregnant, surely. And what is being done about that kind of person. Nyamrerwa, donge wang'eyo jok mamiyo nyithindo matindo ich. Ang'o momiyo kwatergi ka sirikal to wan e sirikal. Nyathi ma So that is one of the key things we have in this program. Now, this program has been led by a very unbogable Homa Bay County CHMT. And in this program, we have three things. We have a joint vision for Homa Bay County that is multi-sectoral, that looks at preventive intervention. Program in Homa Bay, we must work with agriculture, we must work with education, we must work with water, hygiene and sanitation, we must work with gender and also must have a robust community support system that prevents malnutrition. It's a shame that in a county where we supply fish, pod jo wa kech nego. Only describes actions across sectors. It describes a coordination framework for it, a monitoring and evaluation framework for it, as well as an accountability framework for it, because we are also tired of endorsing policies and plans without allocation of resources in a concerted manner. And so moving beyond just launching this plan, we have mobilized the CSA. I am here with our coordinator, Edgar Okoth, who is just to sign a commitment to fund this action plan to the letter for it to be actualized and implemented. Your Excellency, it's also a shame that we are among exist. You find an obese mother with a stunted child in the same household. Something is wrong. And this is predominantly around our diet. Galot matin to wacho ni kuon tokado, donge? To mena be wan go to kwakete. Matunda ka wayudo to wauso. Ng'ato nyiedho dhiang' to uso cha. Okineka okwachiem maber. To chiemo marachno does not only affect malnutrition level, it also affects our brain development and the ability of our children to reach their full potential. Omiyo wadwa tiyo gi nyamrerwa mondo mi wapuonjre chiemo monego bed ni wachamo kaka mane wanene mesa kacha cha donge. And kata bed mana ni wantiere gi rech. The mir kitchen garden wawacho kacha kendo wandike plandwani wadwaro konyo mine gi mier mondo wabed gi puothe matindo tindo kuonde ma wanyalo yude alot pile pile donge mondo wakonyre. Your Excellency, I would like to report to you that we did a very because we are looking not just at technical capacity, but the systems and structures, Your Excellency, that you have put in place to attract more donors. This number of partners, Your Excellency, that will make a commitment today to fund this action plan. It also identifies a appropriate enabling environment for implementation of our programs. In many counties, and our First Lady from Bomet will tell you, we have also worked with members of County Assembly because we cannot do things at the ward level without the political support that we need from you, and particularly female leaders, because we know they have a role to drive health and nutrition issues in line with your manifesto, Your Excellency. Allow me to say a few more things just about the value of our strategy and where it places particular focus. Our strategy in partnership with county governments. And for the first time in 21 counties, Homa Bay is now the 22nd putting money. Doing that is to prove to the development community that it is possible and we are not so much of thieves, because we talk too much about corruption and we talk about it. Besides always fighting with each other and being negative. From our perspective, the purpose of having such a document $90 million, we put 90 million, we match, we make 180 million, and we are able to move together and eventually live for a program to be sustained. To end by congratulating the county team that has worked with us. It's been a long journey. We've worked together for about 6 months to come up with an action plan. And they have played a key role in identifying appropriate solutions for the local situation in Homa Bay County. And Your Excellency, from the meeting we had in December, depending on the drivers of health and nutrition issues in each of the county. For now, I think we are going to proceed with a roundtable discussion. And it's also very disturbing that when we were working with Madam Leila and the national government team, we also mapped partners in county. And Homa Bay County had 35 partners. Most of them are briefcase partners. And so part of our support is to actually provide the county with a platform for partner coordination, so that we are sure that every partner working in this county reports to a target or a framework for action articulated in the CIDP, so that we do not have briefcase NGOs. And when we map who is doing what where at national level, we are told do not go to Homa Bay because they already have 35 non-existent partners. Your Excellency, in my culture, and that's our culture, we say, if you want to go fast, walk alone. But if you want to go far, walk with others. I think this is demonstrated in the speeches I've had today, as well as in the way we have formed this action plan for Homa Bay County. We now have all the ingredients that we need. We have a plan. The leadership has the will. Know where we want to go. We have set very clear targets for the next 3 years. We know the need in Homa Bay County. We know where the problems are. And to support you, to support implementation of this action plan, and to support Homa Bay County moving forward. Thank you very much. Ago erokamano.
Thank you very much. Your Excellency, it is now my humble duty to invite the area member
Thank you very much. God is good, and all the time. Wow. Thank you all very much. First and foremost, to the guest of honor, Professor Olive Mugenda, Gladys Wanga, the Deputy Governor, Oyugi Magwanga, the two first ladies from Bomet and Nyamira, my sister and friend Emily, thank you very much for coming to join us. Let me, and all protocols observed, let me first welcome you all to Kabondo Kasipul. Arwako ute, beduru free, filanga free. I want to appreciate all those who have made this possible. I was here last night, and they told me that, Madam, in the morning you will come and you will be shocked that it is ready. Jogo temano tiyo, go tiyo no mana biro kama yudo, wero kamano for a good job done. And under the leadership of Honorable Governor. Jok mani office mheshimiwa Ivo bara chunguru mondo fwa na jopi. The other side, that is my team. Thank you very much for all the support that you have given to all the officers that have been elected in this county. Secondly, I'm appreciating the people, our guest of honor. I am appreciating the people of Kabondo Kasipul for making it possible for us to be in these offices. Uneweg teach, you're the ones who have given us the jobs, and we committed that under our party, headed by Raila Amolo Odinga, that we were going to work and deliver for our people. I want to thank you all very much. Agonwero kamano maduong kendo appreciate you kendo awachonu ni we will not disappoint. Homa Bay County, Madam Guest of Honor, is the only county where representation, gender representation, is 50-50. 50-50. 3 women elected as MPs in single constituencies, Dr. Lillian Gogo, Millie Odhiambo, and myself. We have a woman rep, Joyce Osogo, aka Bensouda, that is 4. And the 5th one is the one and only Miss Nyasuna Wanga. In the assembly, we have 4 wards. I think this is very important to you, Nyagaya, Madam Nyagaya. In the assembly, 4 wards, again, 50-50. We have 2 women and 2 men. So there is our chief guest. As I saw you here today, and I looked at you, walking side by side by here, you are proud of the outcome of your student. Beunge mano, Professor Mugenda ne en japuonj kendo Vice Chancellor mar our Governor Gladys Wanga. Mano luor makende. Mangiso ni embende no neno gimoro kuome to kobiro kaka wuono ogo tik ni adier. Gladys, even as you invited her,
I'm sure deep in your heart, you also wanted her to see the professor. Professor, look at me now. I did not disappoint you. So, Professor, thank you for the humility to come and sit here with your student, who is now the governor of Homa Bay County. And as the people who spoke here also said, you saw many of your students. One of them is here, the VC, sitting next to you. We're the first for 10 years. Yawakupa mnua uru. So, ground so that they know who is here. And they know that this is one of the women who has inspired a lot of other women, and some of them are here with our governor, to know that it is just not another woman. Jodala wa wan okwa wach ni mine wapiem kod chuo. Ariyo to mpira koka timore nade, mpira mit goyo kendo uneno. To kadine okuyiero Mama Gladys mama, dine okung'eyo ni to kare mine be nyalo timo ang'o. Gimwaneno kaka wuono is a demonstration of your commitment to deliver for the people of Homa Bay. You came here hardly 3 months ago. You looked at what was the situation, and you committed that within your plan, this is one of the activities that you are going to take. That is the reason why it is important that even as you are going to launch the Nutrition Action Plan, it's important that our people also know that you have based on the activities that you have said that you're going to do, and this is one of them, and I can say that you have delivered. Jokmane kwayo ni koroketi equipment itie gimodong. And the key word here to our people, aneno a big group of people here as the staff of the county, manitiere sub-county Marwa, Marka Rachonyo East. The key word here is service to the people. The key word is service to the people. Gikoro tine jo piny, mono jo nonguna no kaka ging'eny. Ging'eny kendo koro wadwaro ni tich. Ka jo piny obiro, iwuoyo kodgi gi duond mamuol. Imiyo gi service ka yath nitie timiye. To mshahara to jitima ngono chamo. Let your salary mean something even for you, that you're being paid. Simple. Mane maduong' manadwa wacho kawuono, okadwa mondo akaw sa mang'eny nikech Mama Gladys nitie gi several programs modwa mondo tim kawuono, an Kidadwa wachonu ni Mama Gladys works through participation with the other elected leaders. Oguyo Kodwa, she's always engaging us, and what share And I'm talking on behalf of all the elected 8 members of parliament. That is what we discussed. I know we have met you severally. We've discussed together. Deputy Governor, thank you all so much for engaging with us. And continue, please, doing that. To our county assembly people with the speaker here, I also want to thank you because we are always together with you, and let us continue. That is the only way we are going to succeed. And that data that was given by Madam Nyagaya, I can our able ministers, thank you all for the service that you're giving. All of you, we've met you, you have engaged us, we have been with you, and let us continue. Akao thuoloni mar luongo our able Deputy Governor, Honorable Oyugi Magwanga. Erokamano. Thank you.
To our chief guest of today, Professor Mugenda, our Governor, High Excellency Wanga, our distinguished development partners here, our Speaker, Honorable Julius Gaya, CEC members present, distinguished ladies and gentlemen, good afternoon. Good afternoon to all of you. Oya oreuru katosa oreuru. To thank everyone here. And I want to thank Her Excellency for providing leadership in this county. A mission and a vision to provide quality and affordable health care within this county. And this as a result of leadership that has actually been proved, and there is no doubt about it. I want to call each and every person that let us team up to support the government for the sake of the service delivery. My dear friends, today is not my day. Her Excellency has a packed schedule, and she didn't even have enough sleep because she worked up to almost around 3. I'll stop from there, and it is now my single duty to invite Her Excellency to invite her chief guest to talk to you. Thank you.
Thank you, Excellency. DG, please be seated. Our chief guest today, my teacher, my mentor, my friend, Professor Olive Mugenda. And maybe I'll just pause for a second to tell the people of Homa Bay how far we have come with you. From when I was a student at Kenyatta University, I was elected student leader. And I was not an easy student leader because I was always carrying twigs. But one way or the other, we became friends. I remember when we went to Mombasa for a Senate meeting, and I got a call that my mother was sick in Kisumu. And we were in Mombasa. And so I came and told you that I have to take a bus overnight to Nairobi and another bus to Kisumu to go and see my mom. You told me, no, you can't take a bus. I'm going to book for you a plane. I had never stepped in a plane. But you told me you're going to book for me a plane, and the plane is going to take me from Mombasa to Nairobi, Nairobi to Kisumu. And that is how you booked me on a plane. And that was the first time I stepped on a plane. Joturua, maneching manango idondege. Ka Professor Mugenda nongado na utiko. When I had my wedding, you came.
You have walked this journey with me. You're my true friend. And therefore, this is not your first time in Homa Bay. When I was woman rep, I invited you. You came. So I just wanted to pause there to just say that I truly treasure our friendship. And as Dr. Obara said, when we walk side by side, because of the great things you have done, I know how you found KU. KU, when you found it, was looking like a witch doctor's home because grass was long up to almost the gate. You changed the face of KU. You had a dream of the KU hospital, and look what it is now. So we hope that can rub a bit on us so that Homa Bay can change in the same manner. I wanted to say that as I went through the protocols. Excellency Deputy Governor, Honorable Yugi Magwanga, MP of this area, my friend, Dr. Eva Kinyobara, Kichwa Moja, Degree Tadi. Degree Tadi? Riek Kosok Riek? Bas. Honorable Speaker of the County Assembly, Oria Wojo Kindu, Jasudan. Honorable members of the County Assembly, led by the area MCA, Peter Nyakomita, Mawud Paramount Chief. Paramount Chief Bedo Wodebe Okiot. Honorable CCs who work together with me, led by the CC for Health, and the CCs who are present here. I know the CC for Infrastructure, Danish, you have spent sleepless nights here. And even me, when I gave you guys this target, I just gave you because the leader must give a target. But also I didn't believe that we were going to turn it around. But you people worked day and night, and we did turn it around. My other very senior guest, Country Director for Nutrition International, who's sponsored us and worked with us to do our County Nutrition Action Plan 2022-2024, Ms. Martha Nyagaya, we value your friendship and partnership. Our dear First Ladies, First Lady, who is the chair of the county spouses, together with First Lady Mrs. Bachok from Bomet. You guys, you've done us proud. You've gone out of your way to come all the way. Our chief officers, our healthcare workers who do this work every day, our CHVs who are here present. I'm also Uni Nyasaye Ber. Sechete. Koro kama intie no gimangima kithni fwane badi ka intie kendi ngima. Kendo intie kendi neno. Kendo CHVs ayie kodu. Nikech uketo mor ka to jomoko bete tencha. Giling ng'iya. Ka nga wuok to giwacho ni jamna. Koro jamna akure to giling welo bobni ka. Jamna to onge otuo jothurwa kata CHVs go sigalagal. I'll read a brief speech just so that I cover everything, and then I'll make a few remarks in Luo, and then I will invite our chief guest today to make her remarks. So, today we are marking the Health Day of our county. We just created it as a health day, given the number of health things that we were doing today. I continue to prioritize health in Homa Bay County, putting in place critical pillars of my Genoa health strategy, including a new board of management, new outpatient, CT scan, and groundbreaking of the referral hospital accident and emergency block at the referral hospital in Homa Bay, implementing the CHV stipend and NHIF subscription. And I have recently gone round our county, engaging with our engaging with our community health volunteers, and agreeing on our strategy for implementing our healthcare. This morning, before I came here, this is the third thing we're doing in these pillars. This morning, before I came here, as part of the Health Day, I assented to the Homa Bay County Facility Improvement Fund Act of 2023, and I thank the Speaker of the County Assembly for passing this critical legislation together with members of the County Assembly. FIF was part of President Mwai Kibaki's reforms in healthcare, where facilities get to use the funds that it has raised to improve service delivery. All our 232 health facilities are on FIF. Let us give a round of applause to those involved in the passage of this act, and we urge the health and finance departments to move forward with implementation. Number 4, our on-source revenue enhancement. Health revenue is now 80% of our on-source revenue. I am happy to note that health services are our best indicator of our OSR reforms. We will continue to offer the best health services to ensure that OSR continues to be enhanced. And improvement, the 5th thing is improvement and upgrading of our level 4 facilities, including the Rachuonyo East facility, including the Ndhiwa facility, including the Rachuonyo South facility, and our referral facility, as well as Sena facility in Fangano. This facility that we are opening today will have a theater, as you have seen, and a 60-bed capacity, and it will greatly address challenges in this constituency. We continue on this journey of health reforms in which we have made many milestones distance to cover. We are marking this Health Day today to cover the following key milestones in our health agenda. One is to conduct cancer screening and awareness, and the First Ladies have spoken to this, to commission this facility, the Rachuonyo East Health Facility, as a level 4 facility and with a theater, to sign an MOU with the KU Nutrition Action Plan, as has been discussed by Martha, and to agree on the financing agreement with Nutrition International. On signing of the KU-TRH MOU, on Monday, 5th of June 2023, I led a delegation to University Teaching, Referral and Research Hospital to explore areas of collaboration and partnership with the County Health Department. The KU-TRH team public healthcare can become in this country. The Homa Bay team marveled at the service delivery and use of technology similar to what would be found in a private hospital. The many areas of collaboration we discussed include training, mentorship and capacity building, starting with critical care and oncology nurses training in September, pathway, health information management system, HMIS, and attitude and behavior change with health human resources. And this has been agreed upon and will be signed here today. I thank KU-TRH and Matibabu who offered to do cancer screening. Mark today's Health Day. The benefit of testing and early diagnosis for cancer cannot be overemphasized as we remind you, our dear citizens, to enlist on NHIF. On the launch of the County Nutrition Action Plan, this is a journey, as Martha has said, that we have walked over the last 6 months, and I want to thank my the nutrition lead in our county for really working together to have this here today. So on this Health Day, we are happy to launch Nutrition Action Plan supported by Nutrition International, who have invited some potential partners to join us here today. I was surprised to learn of our malnutrition and stunting statistics. Our county is well known for the history of Gor Mahia and top footballers. And now with the nutrition statistics that we see, we are at risk of never having this kind of talent moving forward. So we look forward to implement political support for this process, full political will for these processes, and money will follow our hearts. And we don't want our children to be starved because we are known for brilliance. And we were told because we eat fish, we are brilliant. We must remain on that path of brilliance. So with those many remarks in English, Martin Gidoluo, Jodala wa wach moro mako waka. Ungeni en wach mane? Nyithindwa manyiri matindo. Ni ema mako yie mang'eny mogik e Kenya mangima. Bunge wachno, winjo wachno. Paro nyuol, ibro yudo ka dek kuomgi nyaka bed ni en nyathi ma jahiga 14, jahiga 15, jahiga 16, jahiga 17. Koro nyithindo nyuol to mine koro neno. Wachno be en wach maber adier. Koro joma chuo man ka adwa wuoyo kodu. Ung'eyo ni wan kama koro wan e mine nyaburi ni. Wagombo mana ng'ama go kodwa mbaka openjwa oning'nwa wang'e. Openjwa wach. Ha? Kora penjou, ang'o ma koro wewa ne ka wadiwo. Tudhi kuom nyithindo matindo tindo maonge korgi. Ha? Kora dwa kwau. Kuyie, go uru kodwa mbaka wan mine nyaburi gi. Nyithindwa matindo ka wawerego. Wawerego koso wadhigo nyi. Gima timore ni, ka nyithindwa medo mako ich kaka gimako ni, we ang'isu adieri, e higni mabiro, ibro manyo nyara ni wayude mama mabe otegno, nyiri motegno, magon dim. Kidi luongi kisiemo ni macha nyako malacho, wabro biyudo ka onge. Nyithindo wabro bedo nose wuok ka, gisedhi gitedo karungu, koro giteda teda karungu kuro, gikanyam kago. Mane mwadwaro? Akwau jothurwa. Akwau gi muolo gi ng'uono te. Ma ok en wach madwa ni wabede. Prof, I'm saying, our teenagers walk into a facility, and you know, even today we've walked here, and we met a girl with a baby, and she wasn't 20, neither was she 19. She was younger. Yeah. And that's what we see every day. Children are the ones giving birth. I don't know women. So I was telling them, as we are tumekwama hapa, afadhali waongee na sisi. Wachane na wale watoto. We are just looking for someone to wink at us nicely so that we move all these women here. So they should leave the children and come to the adults a bit. That was the story that we are telling here. Mang'eny. Kawuono waya hospital. Nyarai. Nigo na simo ni ibiro hospital ka about this hospital. Ni kawuono ni kia yath onge, kia riembo ji, kia service onge, ang'o. Koro nawacho ni nyarai kar mondo wach ni e simu. Wabiro ka. To wawuotho ka, to wawacho ni yawa. Ma ok condition ma jo onego bede. Chieng'no nen dwe mara 4 karumo. To nawacho ni kapok dwe mara 6 orumo, to wayawo osiptandni. Wayawo koso kwa yawo. Nwawacho ni geno wa en mondo wayud thieth maber. Koro gima dwa na wach katieko. Osiptal ok en ot maber. Ot to koro wagero lerndi. Osiptal en niya, bi nyalo yudo thieth kidonjo iye ka. Be oriti be nyalo yudo yath kidonjo iye ka. Bi yudo daktari moriti maber kidonjo iye ka. Koro mane madwa ni mondo akwa dakteche wa. Adwa na kwagi kabisa. A hospital is not just a good building. A good building is good. But you can be in a good building but still receive poor services, and you still, there is no difference we have made. So the real difference must be in service delivery. And I want to thank our staff because you have improved the service delivery, and I made a promise to you that you will never have to go on a parade because of salaries. And I have kept my promise. Even when national government was not providing money, we kept our promise here to ensure our healthcare workers are paid on time so that they can also live dignified lives. We went to a health summit with you, and we had an agreement. We signed an agreement, a charter. I have gone through that charter. I have met nearly 70% of my pledges, including giving stipends to our CHVs and making sure it goes on their phone and making sure that they are on NHIF. I am remaining with a small part of that pledge. I have 4 years ahead. And that one is on promotions, I know, and other such things. Sasa hiyo naangalia. Lakini nyinyi pia nataka muangalia pande yenu. Koso acho Kiswahili no marachi. Muangalia koso muangalie. Nataka muangalie pande yenu ya service delivery. Prof, one of the things that challenged us most when we were in KU was a people-centered, a patient-centered approach. At the end of the day, when you have finished your day, as a healthcare worker, the biggest question you must ask yourself, my patients who came to see me, did they feel satisfied? Did they feel happy? Even if I didn't have what they needed, did they feel that I supported them and helped them and referred them well? I'm counting on you, because our government, with the DG, we have made a decision. We are a people-centered government. We are centered on service delivery. We are all about the service delivery to our people. Join us in this journey. Please talk well with our people. Please treat them well. Treat them with dignity, because people suffer a lot in their homes. Please treat them with dignity. Help us there. And I ndio akwa maber koso marach. Koro ung'enu sebedo kurito yedhe osiptende wa matindo ka to poko biro. Level 2 gi level 3 yath poko biro, nwachulo KEMSA to arito mwaneno ng'awa. Minomolo kanyino un bung'e. Minomolo kanyunja. Endalo machon mamine ne okser ni makogi. Koro kani wuok idhi chiro ni idhi ramba, iyaka dongi idhi ramba, to ioro ng'ato riti gi ramula ka, to ing'ise niya, cho morwako koti ma brown cha, gi kitenge maralum, mane ma ang' umakna kawuono. Koro, ing'eni ji nohero nomakogi makata mine ne penjo mana ni to an dako osemaka ma nyaka nyachak wuotho kadhi chiro kama kata luok pat tok makan. Koro ka ng'ama ne wuok e chiro mogik, ma wuok ramba mogik, ne en mama maduong' ni iluonge ni Minomolo Kanyunja. Koro ka ji nosedhi te, to en moloro dukni te, to neno ni kamoro amoro lor, to wuok ka koro dhi dala. Koro ka niriti ka, to ni yaka dongo, to kari kala, tichaki chomo mana mawego. Koro giriti ka, magiriti ma piny chak lil, magine nyaka biro. Kaito giduoko wach ne ng'ama nooro gi cha. Ni kawuono kwa yuto ni, warito mwaneno ng'awa. Mana sigand Minomolo Kanyunja. Koro gi weche mang'eny go, allow me to take this opportunity to invite to speak to us our chief guest for today, Professor Olive Mugenda, who is also the chair of the KU Teaching Research and Referral Hospital. I don't know, I mix them sometimes, but karibu sana Prof to speak to us before we go on with our other activities. Karibu.
God is good. And all the time. Thank you very much. I'm very, very happy to be here. Your Excellency, Honorable Gladys Wanga, Governor of Homa Bay County, and my very good friend, as she has said, we have come far, many years with Gladys as my student in KU. And as she has said, she was one of the strong student leaders. But for me, she was my friend. So when she was telling Professor Shiwani he must leave office, for me, he was saying that I must stay in office because I was a deputy to Professor Shiwani. So we started our friendship there. And up to now, she's my good friend. And I'm so proud of you, Governor, for the work you're doing in this county. Your leadership started as a student. I saw you as a women rep doing a good job, and now as a governor. And your leadership we can all see, and we wish you all the best in this county. My other student, mother, you can see I teacher of good students. I'm very proud of you and the work you're doing, not just for Kenya, but also globally. Very, very, very proud of you. The Deputy Governor, Honorable Member of Parliament, Eve Obara, another great leader. You know, she was saying that I was #1 in performance contract, but she was also a very good CEO. We admired her for 10 years when she was heading Kenya Literature Bureau. Very proud of you, Honorable Obara. Keep up the good work. Present, the first ladies of Nyamira and Bomet, very impressed by your presentation. Towards the early pregnancy and all the work you are doing. I also want to acknowledge the county executive led by the CEC Health. I was very impressed by this work you have done here. Also the CEC. The sacrifice and the time it takes to even bring these buildings this far. So congratulations to the team under the governor. And I'm very, very proud of what you are doing. So thank you, Governor. I acknowledge also my team from KU. And maybe before I continue, I would like to introduce them. So if they can quickly come here and just wave at you. Led by our Director, Clinical Services, Dr. Jom, and the team, and also the guests from India. You can come quickly, I just recognize you, because you came here yesterday, because I told them we must support Governor Wanga, so they came here to be doing the groundwork. So this gentleman here is called Dr. Victor Jom. He is our Director, Clinical Services at Kenyatta Teaching and Referral Hospital. A good friend of mine and also a hard-working director. The next here is Dr. Kula. Dr. Kula comes from Ukomeru. He is the head of ICT. He is the one who is going to make sure that we partner with Governor Wanga to bring technology in this hospital. And then Kevin Kongo, he is the deputy to Dr. Kura, also ICT expert. He used to work for the Nairobi County, but I convinced him to come and work for us. Also very, very good. Thank you. We also have a beautiful girl here called Kedi. Kedi is our lawyer. So the MOU we are signing today I had to be convinced that Kedi has gone through, in case I sign things that I don't understand. Thank you, Kedi. Then another very important guest here. This is Mr. Suresh. Mr. Suresh is the one who is in charge of the hospital management system in our hospital, and he traveled all the way from India to come and make sure that we support the governor in matters to do with technology. Thank you, Mr. Suresh. Thank you. You can sit down. So I would like to thank you, Governor, for allowing me to come today as a chief guest and even to open your facility here. I was very impressed because I know as a governor, it would have said I'm the one opening and my name will be there forever because I need a second term. But she said I come and my name will be here forever. And for that, I'll support you until you achieve your goals. And I'm thankful, and I'll make sure that my name is not there in vain. So we are going to do a few things with you to make sure that you succeed. Congratulate the county administration for getting this far, not just for this building, but whatever else you are doing in the county. Is very well equipped, and we'll see what we can do to support you more. I also want to congratulate you, Governor, for the launching of the County Nutrition Action Plan. I will try my best to also introduce you to other partners because you can always develop if you have partners. So keep up the good work. And it is requires a lot of dedication. And I'm sure the people of this county, Homa Bay County, you are very, very lucky to have Madam Gladys as service delivery. Professor, how can we help our people all the time? So I'm going to make sure I do my bit and support her. What we are going to do and what we have decided with your governor is that we are going to make sure that the difficult cases so that we can get the best treatment. And our consultants will be there to help you. And with the technology, so the referral services, and especially on some of the equipment that we have that are not available in other parts of the country. We are the only people who have it, and we have 2 of them. And we have promised the governor that the people who need PET scan for cancer screening, they will be given a very important machine because it's able to see cancer very early at molecular level, so that people don't have to die of cancer, because when it's seen early, then you are likely to be cured than when it is seen in stage 4. So PET scan machine, as I said, in fact, we are the only hospital with a PET scan machine, not just in Kenya, but in South Africa. CyberKnife, and CyberKnife, we are the only hospital with this machine in Africa, except Egypt. Not even South Africa, not any other country in Africa. It's only in Egypt. We are able to be supported by the government of Kenya to get this machine. I think you saw His Excellency President William Ruto coming to commission it about 3 weeks ago. In this county, we are going to corroborate so that they also benefit. The other area we are going to corroborate is the hospital management system, and that is why I requested the expert to come all the way from India. He's the one who developed that system, and this system we are going to make sure that it is sometimes come to the hospital, you just need to use the system to register. You can talk to our doctors in KU through this system. So we are going to install the same system that we have in our hospital, which is going to make the work of the doctors here, the work of the governor easier in terms of treatment. So we have to move with the technology at whatever level, and that is why my whole IC team is here to see how can we work together and be collaborative, and we can be talking to each other. And the doctors here can be talking to the consultants, and even through us, they can talk to other consultants outside the country so that we can treat the people of Homa Bay as needed. And the last collaboration that we have decided is training. And on training, as the governor said, train the health workers in Homa Bay. We are starting with 30 professionals. And Madam Governor, all you need to do is to give them to come to Nairobi. We are going to take care of the accommodation, and we are going to take care of the training costs. I've talked to my CEO, and we have agreed that in honor of our collaboration and friendship, we are going to do that for you. So anytime they are ready, they just at the hospital. We have a very good accommodation. We will give you good accommodation, good food, and also train you, so that you can also establish good networks when you become whatever stage you are. Networks are so important. So we are ready for this training, and it's also on attitude. We want our nurses to be good nurses, and what your governor said is very important. And I remember one of former cabinet secretary saying, make sure that whoever comes from that gate, when they go out with a smile. Whether they were treated, whether there was medicine, just talk to them nicely, reassure them because they are sick. Make sure that whoever comes in this facility, and now that my name is there, make sure that person goes away happy. We don't want to hear that treatment, I was mistreated. Doctors, please see the patients. Nurses, be kind to the patients. Because when you treat them nicely and they are sick already, the problem is already solved. So we are going to be training the nurses from here and even the doctors on a good culture, so that this hospital will be known as the hospital with the best nurses, the hospital with the most caring nurses. And Madam Governor, I will leave it to you to decide who comes for that training. We'll make sure that we give them good training. Another area of training, we are training nurses who are specialized. I think I heard one of the nurses talking about it. Nurses in diploma in oncology, diploma in palliative care, and diploma in theater. And I've seen you already have a theater. So, Madam Waga, we normally take about 25 nurses per year, and I would like to sponsor 2 nurses so that those nurses, when they come and get trained, and then you board them, Madam Governor, make sure that they don't go to other. They come and give this facility service for maybe 2-3 years before they can think of something else. So you collaborate in training as much as possible, because our mandate at the hospital is for not only for clinical services, but also for training and research. And even talking of research, Madam Gladys, you know I'm in research. develop some of the indicators. So mine is to encourage you that just as like the governor said, your age, we are able to do the right thing, we are able to finish, we also have children. Please make sure that you focus so that you can attain your full potential as a job, get some training, so that in future you are not dependent on somebody. Because if you get your babies early, then you start depending on your parents. Women who are here, and even those who are at home, parents, please persuade your children, make sure that you guide them so that they finish their studies. We have done that with our children, and I want and also relax knowing that you have given them a good education and they can take care of themselves. So in honor of the governor, there was a request from the doctor in charge of health. I consulted Dr. Jom about what the first point. The first point is called what, doctor? The first point of care, ultrasound. Point of care, yes. I checked the cost. It's quite high. It's about 2 million. So my promise is that I'll give 1 million, and governor can give the other million. And then now you can have that machine, because the doctor was able to convince us, now that you have a theater, it's so important that you have that machine here. So you do that. I know we are a public institution, but you also social responsibility. So I'll convince my CEO that we give that 1 million. The governor will add, and then you have that machine here. I also know that this hospital is about maternity mainly. Of course, there are also men ward and all that, but one flagship project here is about women and maternity. And I was told by the governor that normally when they come here, they are given a kitty to go home with. You know, some diapers, some mafuta for the babies, a kitty. And I have consulted also, and on my own, I'll give 200,000. So that, and that money is just for the women who give birth here. So the first 200 women who give birth here will go home with 1,000 kitty. So I'm encouraging all the women here to use this hospital. I'm not encouraging that you give birth when you are small. But if you happen to be pregnant, please come here, you get the best care, and I'll support the governor through that small kitty so that we can support the women who are here. So for now, that is what I will say. Thank you so much for inviting me. I'll be a visitor here many times. God bless you, and God bless your governor and every governor. Thank you.
Adding 50 to the kitty. 50K.
Oh, my goodness, here I've been added 50,000 to the kitty from your MP and my friend, Dr. Eve Obara. That kitty is going to grow. Is there anybody else who might want to add to the kitty? Suresh, where is Suresh?
I think I'll add 50 also.
Madam, your governor has added 50 to